Welcome, caregivers. In this video, we will discuss administering eye drops and ointment to residents. Before we begin, we want to check the resident's record to see if the resident has any allergies. Our next step is to review the medication administration record to make sure we have the correct resident, medication, dose, and time. Next, we want to physically examine the medication and compare the information on the medication label to the documentation on the medication administration record to ensure it matches. Lastly, we want to check the medication expiration date. It's almost time to administer this medication, but first we'll need to wash our hands. Now let's go identify our resident. Say hello and introduce yourself. Hello, Ms. Brown, I'm Matthew. How are you? I'm going to be your caregiver today. I have some eye drops to administer to you. Can I verify your name and date of birth? Fantastic, thank you. One last question, Ms. Brown. Do you have any known allergies? No? Great. These are eye drops prescribed by your doctor to treat your eye infection. Before I administer your eye drops, do you have any questions or concerns about this medication? No? Great. Let's get started. Before administering any medication, caregivers should put on a clean pair of gloves. Have the resident sit or lay in a position in which it is most comfortable for them to look up at the ceiling. If required, the caregiver will cleanse the affected closed eye with a cotton ball and wipe from inner corner of the eye outward once. If drops or ointment are to be instilled into both eyes, the caregiver will use a clean cotton ball for each eye. The caregiver will draw up the ordered amount of medication into the dropper and do one final recheck to ensure the label on the medication container matches the medication record. With the resident in a supine position, the caregiver will hold the resident's eye open with one hand by pulling up on their eyelid and down on their lower eyelid. The caregiver will squeeze or pull down on the lower eyelid to form a pouch, then position the bottle over the resident's eye, tip down. The caregiver will ask the resident to look up, then squeeze the bottle to instill the correct number of drops into the pouch. It's important to apply the correct number of drops as ordered. If a resident blinks or moves and squeezes the drops out, they would need to be re-administered. When applying ointment instead of drops, apply a thin layer along the inside of the lower lid of the infected eye, from inner to outer in the amount of ointment prescribed. Do not use your fingers. If both eyes are involved, give the resident a separate clean cotton ball for each eye. Caregivers should change gloves between eyes to avoid transferring contamination from one eye to the other. To prevent contamination, do not touch the end of the bottle or the dropper on any part of the eye. Instruct the resident to keep eyes closed for a few minutes. Wipe excess medication from eyes with a clean cotton ball using separate cotton balls for each eye. Caregivers should remove and dispose of their gloves and cotton balls according to facility policy and wash their hands. Our final step is to document the administration of eye drops or eye ointment on the resident's medication administration record. Caregivers are to include medication given, number of drops or ointment administered, the eye or eyes in which the medication was administered, their initials, and any refusals or unusual complaints or action taken. Remember, any resident refusals to take prescription medication must be reported to the prescribing physician. That concludes our video skills training on administering eye drops and eye ointment. Thank you for learning with us today. See you soon.